Fernández Britto is a doctor in medicine and specialist in pathology for the Havana University, and he's a full professor and chair of the pathology department since 1976. He received a PhD in La Habana, and he's also doctor in sciences for the Humboldt University of Berlin in Germany. Professor Fernández Britto received a degree of full investigator from the Academy of Sciences in Cuba, and he is an emeritus professor since some years ago. He was the principal investigator for the World Health Organization on the biological determinants of atherosclerosis. He was the president of the Latin American Society of Atherosclerosis and of the Ibero-Latin American Society of Atherosclerosis. He was elected full member of the Cuban Academy of Science, and he has been an honorary member of the Atherosclerosis Societies of Argentina, Bolivia, Brazil, Colombia, Ecuador, Hungary, Mexico, Nicaragua, Paraguay, Peru, Russia, Uruguay, and Venezuela. He has been invited more than 85 times to be a speaker in international congresses in North, Central, and South America, as well as in Europe and Asia. He's currently the president of the Scientific Council of the University of Medical Science in La Habana, and the director of the Center for Investigations and Reference of Atherosclerosis in La Habana, as well as president of the Cuban Society of Atherosclerosis. Please, Professor.
I'm an old man. That's the reason of all this. Thank you very much for the invitation, very kind invitation for the organizing committee to have the possibility to enjoy the company of so excellent person here in this meeting. So I will try to speak about these 5 things. Some features related with the Cuban health system, statistical results of the 3 survey of the risk factor of atherosclerosis diseases, result of a whole population research in the island of use of Cuba, some result of research from CIRAS, this is the center I am the director, and a challenger to study atherosclerosis in risk factor and derived disease. So, the evaluation of measures taken by the Cuban Ministry of Public Health for prevention and control of non-communicable disease. Excuse my very broken English. In 1981 to 83, in 1992, in 1995 to 1996, the first national and provincial survey of risk factor took place. 1996, as you can see, prevention and control of non-communicable disease. The 2001 completion of the second national survey of risk factor and non-communicable disease, which contributes to improve strategy. The 2010 completion of the third national survey of risk factor, and in 2011 the national survival system for non-communicable disease. The health situation in Cuba, according to 2011, universal coverage through family doctor and nursing program benefited all citizens. So you can see, this is the figures, and not to read all, you can perfectly understand what is happening in Cuba now. 60-year-old or above, 70.6% life expectancy at birth, and of course female have more expectancy of birth. And also the situation is like this, level of human reproduction is low, and now I should say very low. The birth decreased from 1990 as compared to 1909, 11 births per 1,000 inhabitants, and so on. And we have now a woman in the health workforce, 69.5%, 7,500 doctors, 1 per 147 inhabitants, and dentists, 1 per 925 inhabitants. The first four causes of death in Cuba are heart-related diseases, malignant tumor, cerebrovascular disease, stroke, influenza, pneumonia, and accident. And in the last 10 years, ischemic disease increased 5%, hypertensive disease 14%, and cerebrovascular disease 4%. 80% heart-related deaths, as you can see. Following the largest increase in mortality rate are first heart rate-related diseases, second malignant tumor, but it's very important, the largest increase in rate of potential years of life lost are first malignant tumor and second heart-related disease. The second point, the statistical results of the three surveys of risk factor on cardiovascular atherosclerosis disease are the following. This was a very important national transversal study results which are representative for the country, urban and rural areas, gender and age group. National Statistic Group, the sample design for home survey was taken by the National Statistic Office. 4,150 homes, and in total 7,914 people were eventually interviewed, representing 98% of the total planet. And the information was gathered using the survey proposed who for survival of this factor in non-communicable is a step that everybody knows perfectly that. Smoking prevalence in Cuba, you can see, since the first survey 1995 to the second 2001 was a decrease in the global male and female, and from the second survey to the third survey was also a decrease. We use, of course, the interval of confidence, and as you can see, this is a really improvement, nothing that we are trying. The prevalence of physical activities, according to the place it is practiced in Cuba, physical activity, the people who are active and the people who are not active, you can see that the people who is not active decrease exactly what you can see, and the people who is active in work or in the movement or also in the free time, they are more decreasing in that sense. Prevalence of hypertension, according to the knowledge of diagnostic in the three surveys, also are very interesting because increased from the 1995 to 2001, but decreased now to 2002 in the prevalence general total. In the knowledge is more or less the same, but also decreased a little bit, which is very important for all in the new cases. Prevalence of breeds of central adiposity, which weighs circumference in total population and in both gender. You can see, more or less, it's very interesting because the people, the people down here is increasing female. In female, increasing breeds, and the very high rates is increasing in female in the central adiposity. In the waist circumference, we don't use anymore the waist and the hip circumference. Only we use the waist circumference. And the glycemia by sex, you can see here, we divide it in the following way. Male and female, this is the race, white, mixed or mulatto, and black, and the people who use non-medicament, I don't use these two very much. We have a 10% of the population area which are diabetic in Cuba, you can see, and also it's very interesting how increased in female and in blacks the number of diabetics. You can see here 12.9, 10 for the general, and for the man is 72. And in these cases, the rural area is much less, very important is that the urban, you can see in the male, female, in the white, the mixed, and the black. It is very interesting that we are following now what is happening between the urban and the rural area. Quality of life in relation with health in the Cuban population. In the 2001 and the 2011, more or less the same. We use this mobility of the people, personal care, daily activity, pain and disturbance, and anxiety and depression. But you can see the difference is more or less, the figures are more or less the same. Se vuelven no different on that. Result of whole population research in the Cuban island of youth, one municipality, cardiovascular disease, and chronic kidney disease. Now, the Cuban health system strategy from the island of youth is this that you hear. This that you hear is representing here is a population, you will see, a special municipality of Cuba, same health system and indicator of the country, similar geographic and demographic characteristics and other Caribbean islands, the area of 2,490 kilometers of the population data. And you will see now this, we studied the 92.5% of the whole population. Perhaps it's the only who have done in a world that in an island that we study the 92.5%, not the sample. We use the whole family, 21,150 family, 77,462 persons. The positive and negative, the renal damage, and the result is the following: proteinuria, hematuria and proteinuria, and microalbuminuria. You can see here the underline.